Hi, my name is Bailey Knight. This is Rebecca Baroni, Elizabeth Juarez, and Yasmin Frazier. And today we are going to be introducing to you all the Birth Equity Network, BIN. It is a healthcare innovative solution we've created to solve the tax on motherhood.
We're going to start with a brief history of women healthcare in the U.S. Throughout history, it has been unfair and unequal treatment for women in the U.S. In Puerto Rico, poor working class women were targeted for sterilization treatment because they were blamed for overpopulation in the island. Further, women's symptoms were not taken as seriously as their male counterparts, and they were often diagnosed with hysteria. The most prominent moment in U.S. history, which highlights the unfair and unequal treatment of women, was the experimentation done on black slave women. This racial discrimination did not end with slavery and is still present today as many providers still show racial bias towards women of color.
Let's discuss current impact. After generations of persistent mistreatment of women of color in maternal health, the data clearly shows the consequences. A study from the National Health Center for Health Statistics examined how many maternal deaths occur per 100,000 women and compared the numbers across racial groups. Here, the differences were unmistakable. Black women experienced maternal death rates 3 times higher than any other racial group. Meanwhile, Hispanic and Asian women had mortality rates that were either similar to or lower than that of white women. This contrast highlights how both of the racial groups often benefit from social privileges that African American women typically do not have. For example, some Hispanic individuals may be white passing, and Asian communities are frequently labeled as the model minority. Describing these social patterns matters because they directly shape how pregnant women are treated when they seek medical care. When a woman enters a healthcare setting for reproductive support, factors such as cultural background, financial circumstances, and living environment all influence the level and quality of care she receives. This right here is the social determinants of maternal health scenario. This encapsulates a scenario of a woman under certain social circumstances and how those social circumstances affect her life and the care that she is given while pregnant. Generational trauma affects the psychological harm passed through the ancestral community, and its effects appear clearly in the health and lived experiences of people of color who face consistent and systemic neglect. For women of color, these inequalities intensify during pregnancy and through unequal access to financial stability, like this woman here, redlining neighborhoods, like this woman here, and medical racism, which is what she ultimately ends up facing as well, which leads to her fatality. These barriers limit equal care, reduce the ability to advocate for themselves, increase stress, and restrict access to safe providers and nearby hospitals. As a result, Black women experience far higher pregnancy-related complications and mortality, showing how deeply racism and inequality affect and shape maternal health.
As made clear by Bailey, our target population is women of color in Georgia because they face distinct barriers for their women and maternal health. Over 159 counties are maternity care deserts, meaning they have no labor and delivery units, no OBGYNs, and no prenatal care available. Georgia also has a 6-week abortion ban, which restricts access to care. Women of color often have fewer financial resources and transportation options to get this care in different states. Additionally, Black women face higher rates of prenatal mood disorders, such as postpartum depression. All these factors contribute to why Ben is focusing on women of color.
Our solution, BEN, the Birth Equity Network. It was created to uplift and support pregnant women of color in Atlanta, Georgia. Its purpose is to confront the disparities and barriers these women face by expanding access, strengthening advocacy, and building community. BEN provides 3 key elements. First, it amplifies women's voices through the Rate My Provider app, a safe space for expectant mothers to share stories, review providers, which will hold professionals accountable, and Also, encouraging more respectful and unbiased care. Second, Ben offers financial support through the Her Future Stipend, which provides a $300 Visa gift card to individuals who receive a positive pregnancy test from a partnering clinic. The stipend gives flexible assistance to those facing financial or health-related challenges during pregnancy. Lastly, Ben deepens community connections by partnering with organizations like Planned Parenthood and nearby clinics to make resources more accessible and coordinated. These efforts help create a more informed, supportive, and equitable maternal health experience for women of color.
The conclusion of this project basically states the racial bias in local and national policy and lack of community support are significant barriers for women of color to thrive in womanhood, early motherhood, and beyond. Systemic structures that have misogynistic undertones as well as racial discrimination being upheld or ignored. By providing aid to women in Georgia who want to access abortion care not available in the state, Ben is bridging the gap to care. Ben is also giving autonomy back to the Georgian women of color and helping them in deciding when they are ready to start motherhood.
That was tea. That was